New Directions in Child and Adolescent Treatment, the conference you're running with Pat Ogden, September 11th, 2011, I think at UCLA, right?
That's right, yeah.
Tell me a little about the conference.
This is a whole new way of working with children, adolescents, both individually and in group. What we're looking to do is travel the new integrative frontiers, being able to work with traditional psychodynamic psychotherapy, but taking the work beneath the words, helping to understand the body, the implicit procedural memories, the sense that the experience that the client, child or adolescent or young adult has, is carried in their soma, in their body, as well as in the stories. Mm-hmm. We all know people who will go to therapy and tell one story to one therapist, then go to the next therapist, they'll tell their story over and over. What we find is that the real work often is much deeper than the words and then just the meaning that they're finding. So this is a way of working using mindfulness, using integrative neuropsychology, tracking the body, working with the movements, the gestures, the meaning, the beliefs, all through the realm of sensory motor psychotherapy.
Mm-hmm. And can you tell me a little about how that works with children, in particular in adolescents?
Well, we'll be using a lot of video work that Dr. Ogden and I have done over these last years as we developed this new program to show ways of working, addressing various different issues, particularly the trauma that kids feel, experience, and often that follow them long after the trauma is experienced.
Mm-hmm. And with clients who haven't experienced trauma, or big T trauma as it's called, the little traumas in life, or maybe some developmental trauma, or other issues like ADD, or some other diagnoses that they may have, do you find that this is helpful for that?
Well, Dr. Ogden's broken her training down. It's an ongoing, year-long, and then 18-month-long, 2 different trainings, one focusing on the trauma, the big T trauma that we experience, but the other, the trauma that all of us have had, developmental trauma. Most of us come through life experiencing bumps along the way. Mm-hmm. And so both are addressed in this method, and that's the beauty of the training, is that we learn to discern, separate out. Often there's both traumas, or one causes the next.
Mm-hmm. Okay. How has it changed your work as a clinician? You're a child and adolescent specialist. How has it changed how you work with your population?
Well, I'd say for years and years, I really looked just at the top down, the words and how they were experienced, and then how that affected the body. But now, this last decade, I've been looking at bottom up, looking at how the body and the meaning that we make with our experience affects our understanding of how we live our life, and helping our clients to live a different life, to make shifts, to integrate new information and change how they carry that information.
Mm-hmm. And as a clinician attending the conference, what would I expect? What kind of training would I be leaving with, and what kind of how would this help me on the day-to-day with the clients I work with?
Well, it's our hope. Dr. Ogden and I are hoping that you'll have new tools to take back to the office Monday morning.
Mm-hmm.
That you'll be able to choose from a menu of options.
Mm-hmm. All right.
Thank you.